Hi, my name is Zofia Czarnecka, and I'm the medical student involved with Tele-Rehab 2.0 at the University of Alberta. This is a project that has been in the works for many years, but was formally started in January 2019 with funding from Alberta Innovates and Pfizer, and has become increasingly relevant with the onset of COVID-19 this year and many clinics switching to virtual care models. The goal of our project is to connect rural Albertans with specialized care and assessments right in their home communities. The clinical focus of this project can be summarized in 4 areas: hip and knee replacement follow-up, severe shoulder pain, vestibular balance issues, and wheelchair and special seating requirements. We've developed clinical storyboards and created technologies to help specialists complete comprehensive assessments for patients who are sometimes hundreds of kilometers away from an urban center. The specialists will receive some patient history before this appointment. However, each assessment starts off with a conversation between the patient and the specialist to fill in the story and for them to get to know one another and establish a trusting relationship. This was really important to us as we didn't want to lose this human aspect of healthcare in a virtual setting. After this initial conversation, the specialist can guide the patient, with the support of the local physiotherapist, through different measurements or tests to complete their assessment. This starts off as visual only, for example, seeing if someone's shoulders are symmetrical in height or have any obvious bony deformities, or visually assessing someone's stance, gait, or posture. However, the great part of Tele-Rehab 2.0 is that we have this phenomenal technology developed to add another layer to our assessments. Each site, we have a desktop computer on a cart, which houses software for video capturing, and also our markerless motion capture system called KinetiSense. KinetiSense can record the way a patient sways while standing with eyes open or closed. It can also track gait while a patient walks. We're working with the company to capture range of motion angle data, which will be critical for our knee and shoulder assessments. In the remote sites, we also have a double robot, which is a self-propelled telepresence robot, allowing the specialist and patient to feel as though they were in the same room. And finally, we have our vestibular goggles. These allow us to have a close look at the patient's eyes in darkness. Assessing their eye movements is critical for diagnosing different vestibular conditions, noticing things such as nystagmus, and tracking eye movements to ensure we're not missing any more serious neurological signs that might require more urgent investigation. Sometimes our specialists initiate a treatment remotely, and then once that and the assessment are completed, the whole team, including the patient, has a conversation about what they saw and answers any questions. This is also unique to our project, as normally a patient wouldn't be included in the conversation between clinicians. So far, we've started trials in 4 rural communities in Alberta. Patients commend the project for making rehabilitation convenient and easily accessible. The rural physiotherapists are also super happy with it and grateful for mentorship opportunities and the ability to further their skills by working closely with specialists. We're very excited to continue trials with Tele-Rehab, and we're excited about the different ways this model could be adapted to be used in different clinical areas in the future.